spoke in previous videos about subclavius trigger points. We talked about pectoralis minor trigger points and how they cause and refer pain down the arm. As a massage therapist, you have to pay special care to tend to these areas because we work a lot with our hands, manual labor. And in working with forearm, hand, and wrist pain, you also want to take a look at Flexor Carpi Radialis. The forearm flexors move your hand this way, curl you into a fist. The forearm extensors extend the hand. Flexor Carpi, carpals. Radialis is towards the radius. This is the ulna. There's also Flexor Carpi ulnaris, we'll cover in a later video. But Flexor Carpi Radialis, it's almost right in the center of the forearm. When I apply a small amount of pressure with my thumb, you can see that I'm pressing down like this instead of with the point. I can already feel a little bit of sensation down to my fingers and down through my wrist, usually around here. These muscles get lots of work for body workers, maybe people who have carpal tunnel syndrome, who work at a computer extensively. And I'm just applying pressure right into that spot. And again, I can feel it down to my middle and ring finger on this side. This is a good way to work on yourself. You can see that I'm putting a little bit of strain on my hand. So in order to work on this, I'm going to shift positions so that I can put my forearm here, and then I can slowly slide an elbow down into the same spot comfortably. If I wanted, I could place this forearm up against a wall and use a tennis ball, a golf ball, something pointy. Again, I can feel that down through the wrist, right where you think of carpal tunnel being, except it's on this side of my hand, the palmar side of my hand. And I'm pressing into a trigger point in Flexor Carpi ulnaris. Flexor Carpi Radialis in this video. So, down to my hand. My hand is turning a little bit light in color, I think because I'm restricting some of the blood flow. As soon as I let off, you can see that it flushed. One of the fun things about body work is comparing traditions. This spot in Western bodywork, trigger point therapy, Flexor Carpi Radialis, sends some trigger point pain, referred pain down through the wrist to the fingers. This is a sim line in Thai massage, which goes right in between the radius and the ulna, up this side of the arm, and then bisects the bicep and the tricep. I don't think that those traditions contradict. I think they're just different maps of the same physical structures across culture, across time. So, Flexor Carpi Radialis. If you're having problems with your wrist, try working on this. If you can't hold pressure yourself, have a loved one do so. If you're using your elbow, this is very pointed. If you soften it and use more of the flat, it's going to be a little more broad, a little more soft. Try it out and see if you can work with some of your wrist pain. If you do lots of typing and lots of work with your forearms and hands, like I do as a massage therapist, you may be getting referred pain down into your wrist. I'll see you again soon on robertgardnerwellness.com.